Welcome to my YouTube channel. Our today's discussion is 3 common cough medications: 1. Dextromethorphan, 2. Guaifenesin, 3. Codeine. 1. Dextromethorphan. Key points for dextromethorphan: 1. Suitable for dry cough in adults and children over 6 years old. 2. Acts on the cough center in the brain to reduce cough reflex. 3. Common side effects include dizziness, drowsiness, and nausea. 2. Guaifenesin. Key points for guaifenesin: 1. Suitable for wet or productive cough to loosen and clear mucus. 2. Works by thinning and increasing the flow of respiratory tract secretions. 3. Usually a well-tolerated medication with few side effects. 3. Codeine. Key points for codeine: 1. Suitable for persistent or severe cough, but not recommended for children. 2. Suppresses the cough reflex by acting on the central nervous system. 3. Common side effects include drowsiness, constipation, and nausea. Question for this topic: can you list one counseling point that you should provide to patients about cough medication?
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.